recent research into interventions to prevent or lower the incidence of intensive care unit delirium, ICU-induced delirium, in mechanically ventilated patients demonstrates better patient outcomes in several areas of measurement by the implementation of this multi-component therapy named ABCDE bundle care. ICU-induced delirium is a significant issue which results in more days spent mechanically ventilated, increased lengths of stay in the hospital, and also a decreased independence upon a patient's discharge. Our research and PICO question that we looked into in terms of addressing delirium in the ICU is in mechanically ventilated patients in the ICU, how does early physical occupational therapy compare to ABCDE bundle care? And how does this affect the prevalence of ICU-induced delirium? Now, the ABCDE bundle care is a multidisciplinary approach to responding to mechanically ventilated patients, and it has been shown in multiple studies to reduce the duration of delirium. The bundle includes for A, awakening the patient daily, also known as an awakening trial, spontaneous awakening trial. B, daily interruption of mechanical ventilation to assess the patient's breathing, also referred to as a spontaneous breathing trial. C is the coordination of delirium, C is the coordination of sedation medications, and it coordinates the medications, specific medications, with, in order to prevent, in order to allow actually the spontaneous awakening trials and the spontaneous breathing trials to occur. All right, the next component of this bundle care is D, and that is for delirium monitoring. And nurses use several tools. One is the intensive care delirium screening checklist in order to screen for and monitor for lengths of days of delirium. And then there's also another tool called the confusion assessment method in the ICU. It's also called the CAM ICU screening tool. Now, our final component for our bundle care is E, early mobility or exercise. Now, the evidence affirms the effectiveness of this entire multifocal approach as opposed to just one component, as we looked at in our PICO, which was occupational and physical therapy. It is truly this multifocal component approach that results in positive outcomes, such as reducing the patient's hospital length of stay, reducing and preventing delirium states, and increasing the well-being of the patient after discharge. Our recommendations would be to implement the ABCD bundle care into the hospital's policy as standard practice and interventions for patients that are intubated and mechanically ventilated in the ICU. Now, we looked at the applicability of this bundle care intervention, and we looked at several different ideas of how we could implement this with a coordinated care team. And some of the aspects that we considered in looking at ideas of how to implement this care were looking at the effectiveness of an approach, looking at the feasibility of an approach, and looking at the cost. When we looked at these three components, we scored them and ranked them. We came up with a coordinator is needed to implement ABCDE bundle care. Now, the coordinator is able to communicate with all of the care team, and our recommendation is to appoint an ABCD coordinator. The patient's ICU nurse should be this coordinator and facilitate the bundle care implementation. This idea is cost effective since the ICU nurse is already caring for the patient, so it will not add to the intervention. add to the intervention's cost. The idea is highly feasible and effective because the patient care is already being coordinated by a trained complex care nurse who can work and communicate with other members of the team, the respiratory therapist, the physical therapist, and the healthcare provider. Regarding communication to our fellow colleagues, we recommend that there be interprofessional training sessions at the hospital in order to delineate how communication is going to occur, introduce how working with the ABCD bundle care coordinator will be implemented, and also education and training for the doctors to look at different types of sedation medications and how that can be coordinated with the spontaneous awakening and breathing trials. So we have found in our research that this protocol will result in positive patient outcomes in the long term.